Hey guys, it's the Crafty Prepper, and I just want to give you a couple tips today from a nurse's point of view. I work as a nurse at an urgent care, and some of the things we talk about are for the flu season that's coming up. It's a virus, it's not bacteria, so the alcohol antibacterial pumpy stuff that you just smear on your hand instead of actually washing them is not going to help with the flu or other viruses. Like Ebola is a virus too, so keep that in mind. But that's a whole nother set of concerns. Anyway, so just try to be conscious of what you do with your hands. Keep them to themselves. Don't touch your face, rub your eyes, any of that stuff. Just be mindful of where you put them. If you're going to the store, don't touch the door handle that everyone else that just went touches. Use the sleeve of your jacket or your sweatshirt to open the door. And when you wash your hands, use regular soap. I don't recommend the antibacterial soap because I believe the hype about that it does more bad than good. So research it yourself and make your own choices, but just use regular soap and hot water and do a thorough in between your fingers, back of your hand, tips of your fingers, fingernails. Just do thorough hand washing, and try to avoid, if you're in a customer service position and you have to be face to face with people, try to if you notice they're coughing and sniffling, it is not rude. If someone is gonna be about to cough in my face, it is not rude in my mind to dodge. It maybe will make them think, oh crap, I just coughed in her face. Because I had a patient come in just the other day. I was like, okay, what are you here for today? And she goes, that. I was like, really? Jeez. I mean, this is a grown woman like my mother's age. She could have just said, I have a cough, instead of coughing in my face. So stuff like that. Try to dodge and prevent. Like when I do a person's blood pressure and pulse and stuff like that, I don't stand in their face, because everyone that's sick, like if you're congested and your nose is stuffy, you're like I'm not gonna be right in there. I stand to the side and count their pulse, almost facing away, and take their blood pressure to the side so that they're not, all in my face. So prevention, things like that. And I also believe that you should try to build your immune system, well, all the time, but especially during the winter, fall and winter, by eating. If you're not going to eat healthfully, clearly I'm not the most healthy person, you can tell by my size, but try to eat a lot of fruits and vegetables and healthy things. Don't eat a bunch of junk and fast food and a lot of sugar. I think that sugar defeats your immune system, and a lot of your immune system is in your gut. So if you like yogurt, go for it. If you don't, try probiotics. But all of this stuff, do your own research. Don't do it just because I said it. Figure it out for yourself or ask your doctor. And also vitamins. I like the Airborne brand of things because they have a vitamin now. It's vitamins combined with zinc and echinacea and things like that. So herbs and vitamins together, which I think is a good idea. And so, what else? Oh, and speaking of like herbs and stuff, my sister has asthma and has a lot of respiratory problems, and she uses, she takes some eucalyptus essential oil and put a drop or two on a Kleenex in a Ziploc baggie, and now this is what works for her. I've seen it work on my niece and nephew. It's worked for me. So again, do your own research before you just start doing something somebody on YouTube told you to. But she'll just like kind of breathe that eucalyptus oil a few times a day, and it really shortens the length of her colds and congestion. It'll open you up right away, but it is, I think she said, I don't know, I haven't researched this, but she said it's antibacterial and antiviral. Anyway, it does loosen mucus in your lungs and things like that and open you up, and I think it helps you recover faster from a chest kind of cold. Once again, see your doctor. Anyway, so that's some tips. I think that's all I was going to tell you. Just be mindful where your hands go, you know, not your face, not straight off the bathroom. I mean, most people use a paper towel to open the bathroom door after they've just washed their hands. That's a good idea too. But, you know, keep them to themselves, because a lot of germs, you do a lot of touchy, and germs like to hang out there. That's all. Take care. Be healthy. If you got any other ideas, let me know. Anyway, it's Saturday. It's nice out. It's about to get cold in a couple days. It's the fall festival in the town near me, and it's very exciting because there's thousands of people there and lots of food. Good food. Not the kind of food I was telling you to stay healthy about. You know what I'm saying? But it's a special day. Anyway, take care. Bye.